You're watching TVC Breakfast. Now, today is World Sickle Cell Day. It is a day when issues pertaining to the management of the disease are put on the front burner to avert deaths through the condition. Now, sickle cell anemia is a condition that occurs when some red blood cells become deformed and look like sickles, blocking blood flow to the hands and feet. It also destroys the spleen, which helps the body system fight diseases. Presently, Nigeria has the highest number of people living with the condition in the world, meaning that the country needs to step up awareness on sickle cell disease to avert unnecessary deaths and suffering for many. Joining me now via Skype is TOYIN ADESOLA, Executive Director, Sickle Cell Advocacy and Management Initiative. It's nice to have you join me this morning, TOYIN. Now, when it comes to management of sickle cell, talk to us basically. What is most challenging with managing a sickle cell patient?
I think the most challenging thing is managing the pain and the complications. The pain is separate from the complications. You have sickle cell pain, which is called the crisis. And a lot of people don't understand the level of pain. Sometimes they think we're pretending. And so the pain management they give us tends not to be effective. And is when things worse, they start running helter-skelter to sort out the issue. Then you have the complications. Because of the way our blood cells are, they're tiny, they can get blocked anywhere. And so you can have a stroke, you can have organ damage and different complications. So I think it's understanding how to manage it is the most important. A lot of doctors haven't really been taught because it's not like a major course when they go into medical school. Maybe it's like a 4-hour course. So a lot of information about real managing of the pain is the challenge.
All right. So you talk about the crisis situation. What really triggers a crisis for anyone who is suffering from sickle cell?
Okay, it could be several things. One is dehydration because of the way the blood cells is. If we're dehydrated, they don't flow easily. Then you have infection, and infection can come from anywhere. Then you have physical and mental stress. And then you have emotional stress. A lot of people play this part down because they don't realize how challenging it is and how it triggers crisis. So those are some of the basic. Then you have also anemia, that's low blood level. Our PCV tends to be low sometimes, and when that happens, it triggers it, and also malaria also triggers it.
All right. As it is right now, at least from the reports available to us, there is no cure for sickle cell yet. But so if we have to narrow down to the preventions, what would you advise is the best way to avert or prevent sickle cell?
Okay, I want to correct a notion. There is a cure. It's just that it's not widely available. That's bone marrow transplant.
The transplant. Okay.
Transplant.
Yes.
Yeah, but it's very expensive, and then you have to find a match. So for preventive, I feel education and awareness is very important. Unfortunately, we have not really done it as we should. It needs a lot of money to go into villages, to tell them to do genotypes, and they're like, why would I spend 2,000 naira to go and do genotype when I'm barely managing to live my day-to-day life? So it's very important that if we can also do the genotype, it will be good to help people to know their genotype, to know so that they can make informed choice. I don't think control is the right thing. I hear people trying to do a bill to control. You have different issues. You have labs that give wrong information about their genotypes. And you have people who don't even go to hospitals to even say that they would know their genotypes. So I think awareness is very key. We need to go into the nook and cranny, educate even people within the village to educate their peers in the village as well.
All right. Every year on a day like this is World Sickle Cell Day. So how best can we commemorate today to record the kind of impact that we want to see?
Yeah, I think one of the major things is that a lot of us focus so much on preventive, but we tend to forget those who are already living with it. And I think we need to lend our voices more to those because a lot of times some of people face stigmatization. They also have lack of access to medical care. HMO is difficult to get in most cases. So this is very integral in our growth and our health. So I think we need to lend our voice more. As people, warriors, as people with sickle cell, we should speak out more. And as people who want to support this cause, we should talk more and help those who are going through challenges living with sickle cell.
All right. So people who live with sickle cell, what are the everyday habits that they should imbibe to ensure that they stay away from triggering a crisis, from what they eat or where they should go or how they should behave?
Well, I think the basic thing is for them to understand their body. Everybody's experience is different with sickle cell, but one of the key things is that drink, water. It's very important. Even in this so-called cold season, there's a tendency not to feel thirsty, but don't wait till you're thirsty before you drink water. It's very important. And then eat vegetables and fruits. It's very important. We also have our normal drugs that we take, but that adds to helping our immunity, building our immunity up. Then also have a positive mindset. Don't stress too much. And physical stress is also a negative for us. So try and manage your situation. Once you know you're getting tired, step back. Explain to your bosses, explain to people who are involved that at that point in time, you're not feeling well. It's not a continuous thing, because people have this perception that people with sickle cell cannot do anything, but we can do it, but we just need to pace ourselves.
All right.
And then surround yourself with people who can be supportive, both medical personnel and also people around you, family and friends.
Okay. For those who are living with sickle cell, we are at the time where things are very difficult right now worldwide with COVID-19. How is it impacting on those living with sickle cell anemia differently? Can you talk to us about this?
Okay, yes. First of all, from the point of view of the person with sickle cell anemia, they are afraid to go to the hospital. They don't know if they'll get COVID from the hospital and all that. So a lot of us want to stay at home and manage our healthcare, which can be dangerous at times, especially when it comes to self-medication. Then on the other hand, you have doctors, not doctors, but hospitals rejecting you for fear it's a COVID thing, because there are sometimes we have what you call acute chest syndrome, which is a bronchial infection, and sometimes it can look as if it's a bronchial issue associated with COVID. So unless they really understand what it is, they may think, okay, this person has got COVID. So there's a chance that, okay, they will reject you. So those are the challenges. For us as an organization, we even had challenges reaching our people, because we used to do a free clinic every month with over 250 people. But now we've had to stop it, and we just have to keep connecting with them through various means, phones and everything. So it is indeed a challenge.
All right. We have to leave it here now. TOYIN ADESOLA, Executive Director, Sickle Cell Advocacy and Management Initiative. Thank you very much for talking to us on TVC Breakfast.